Nicole Johnson for DLife.com. There are several different types of diabetes, but they all share a common feature. People with diabetes can't regulate blood glucose or blood sugar properly. Because blood glucose levels that are too high or too low can be harmful to the body over time, proper treatment of diabetes is critical. There are three main types of diabetes: type 1, type 2, and gestational. Type 1 diabetes accounts for between 5 and 10% of all cases of diabetes. Because it occurs frequently in children, type 1 is sometimes called juvenile diabetes. People who have type 1 diabetes must inject or pump insulin to live because their pancreas no longer secretes insulin, the hormone that helps to regulate blood glucose levels. Type 2 diabetes is the most predominant form of the disease. It occurs most often in late adulthood, although younger people can also develop it. People with type 2 are insulin resistant. That means their cells don't process insulin properly, resulting in high blood glucose levels. Over time, the pancreas of a person with type 2 diabetes can also lose the ability to produce sufficient amounts of insulin. A combination of diet, exercise, and medication can help control type 2 diabetes. Some people with type 2 diabetes also take insulin to manage their blood sugar. Gestational diabetes is diabetes that occurs in pregnancy and resolves after birth. Getting quick and tight control over blood sugars is critical because high blood glucose levels can cause damage to a developing fetus. Gestational diabetes can be treated with diet, exercise, and sometimes insulin. Women who develop gestational diabetes during their pregnancy are more likely to develop type 2 diabetes later in life. The main goal of managing all types of diabetes is to keep blood glucose levels in a safe range for the long term. All people with diabetes should test their blood sugar regularly to determine how food, exercise, and activities impact them. Talk to your healthcare provider about blood glucose targets that are right for you and how to achieve them. For more information and support for your diabetes life, visit DLife.com.